Mentor from EM and Masters. Today, we are going to discuss about common surgical conditions which normally come in our MRCS Part A exam and which every candidate must know before sitting in his or her exam. These are very basic conditions, and I have taken them from the very syllabus that Royal College has displayed on its website. And by noting these things and these conditions, you can guess what type of pattern and what kind of conditions you will face in your exam. So we're going to start now. Let's discuss about the common surgical conditions which normally come in our MRCS exam, the core principles for passing the MRCS Part A, and which are required for your success. So, what kind of topics you have to cover in your exam? In MRCS Part A exam, the examiner wants to know the detail of some very important common surgical conditions. That you will encounter in your routine practice also. So if you are a surgical resident, these things are very common for you. But if you are like you have just gotten off from your house job and now you want to sit in an exam, then you have to know these things. Because if you are a resident in surgery, these common conditions you will encounter in your first 3 or 4 months of your practice. So there will be approximately 45 questions, 45 MCQs that will be directly or indirectly related to these surgical conditions. It means that by remembering and by getting the knowledge of these conditions, these parameters and these areas, you will have the ability to answer approximately 45 questions in your exam. That will make a huge difference in your exam. So, what are the areas which we have to cover in our MRCS Part A? So, one are the so start with the gastrointestinal disease, then our breast disease, then vascular disease, the cardiovascular and pulmonary disease. Then comes the genitourinary disease, orthopedic conditions like we discussed in our last webinar. Then the diseases of the skin, head and neck, the neurology and neurosurgery, endocrine disease, the lymphoreticular system, the principles of cancer therapy and palliative care, and then the acute emergencies. So these are the broad areas from where the examiner asks questions regarding certain conditions. So what are these conditions? Let's go through one by one with examples. So first, let's look over the gastrointestinal diseases. So gastrointestinal system is vast and will cover your most conditions. Basically, yeah, they will condition from upper abdomen, from the liver, from the pancreatic system, from your pelvis, from groin mass, from hernia. So I have taken some examples from some very common conditions. Like the question will be asked about your acute abdominal pain. So what might be causing your acute abdominal pain? Some if in your routine practice, if you are a first year surgical resident, you will see a patient coming to the emergency with the complaint of simple abdominal pain. So, how will you assess the patient? And then you will think certain things that he might be having this and that, and then you will go and examine the patient to rule out these things. So, what are the causes of the acute abdominal pain? So, MCQ will be based on the causes. It can be based on investigation. So now next step is investigations. What kind of investigations will you get at the for the acute abdominal pain? And the third point is management. They will commonly ask their fourth favorite question is management and investigations. They are very important. They might ask questions regarding the causes, but mostly they focus on the management of acute abdominal pain. So, for example, there is a condition like patient may have appendicitis, the pain of appendicitis. They might ask, so okay, so patient is having pain in right iliac fossa. What might be other causes? So, you're seeing a rule out. This is not appendix. What might be the other cause? So, like that. So next we check the groin masses. What might be the differentials of groin mass? It may be hernia. So it may be a direct or indirect hernia. So I have labeled hernia as a separate entity because hernia, this is a favorite topic of exams. You may face one or two questions directly related to hernia. So what are the complications when you are doing hernia surgery? You are placing mesh, you might compress a nerve. What is the name of that nerve? Okay, so you are placing the hernia incision. What type of incision is this? And what are the hernia types? It may be a femoral hernia, it may be an inguinal hernia, it may be a direct or indirect hernia. They may ask the anatomy of the hernia. So then the other question is the irritable bowel syndrome. They might ask about what are the symptoms of irritable bowel syndrome and how will you treat. Like they may ask question from the treatment of the irritable bowel syndrome, or they might ask question from your symptoms. Then the Meckel's diverticulum, because I have recently gone through the past paper. I saw them, and many a times Meckel's diverticulum, they asked about the anatomy and especially the histology, like what type of uh, cells are present in the Meckel's diverticulum and what do they produce. So, like that. And splenic vein thrombosis is another important topic they might ask questions from. So, splenic vein thrombosis has certain complications, and you have to know these complications because I've summarized these things because of their importance. Next, we discussed about the breast diseases. Uh, in breast diseases are most frequently asked question exam. You face for about four questions at least in your exam related to the breast. What kind of questions they might ask? They might ask about common benign breast lesions, how do you diagnose them, how do you manage them, certain benign conditions. And now we are discussing about the non-malignant diseases, like how do you biopsy them, when to do the TrueCut, when to do the FNAC, what is the advantage, disadvantage of biopsy, and when will you do the lymph node biopsy, when will you do and when will you not do. So these are important points. And finally, the breast cancer, they will ask about what kind of imaging you will do and what is the screening protocol. This is very important. They might ask that patient has an old age patient who has confirmed invasive ductal carcinoma, and now she has her BRCA1 gene, BRCA1 BRCA2 positive, and now her daughter is there, which is 22 years old, and now she's worried about the risks she might have regarding her cancer. So, what screening therapy will you suggest her? This is the type of question you will face, and you will place the screening at 2 yearly program and 5 year program whatsoever. That we will discuss when we'll discuss about that relevant topic, but the importance of topic lies in. Then there are vascular and cardiac diseases. Again, this is another important portion. And MRCS exam wants to evaluate your knowledge of the most common congenital and acquired heart and vascular conditions. The most important congenital condition is like cyanotic heart disease, like tetralogy of Fallot. That's a hot favorite question of exam. If they want to ask you something from cardiac section, they will ask you from the tetralogy of Fallot. They will ask something about it. They will ask something. They can ask anything. They might ask about the pathophysiology of the this condition, or they might ask about symptoms, or sometimes they might ask about treatment. But mostly they focus on the anatomy and the pathophysiology of this and the initial symptoms with which the child will present. Again, there are certain carotid tumors. You might this is I just label that diagnosis means that you have to know that there's something about the carotid tumors. You have to know what kind of tumors are there. Just like that, they will not go into detail because carotid surgeries are uh, quite an extensive surgery, and they quite expertise is required to do this surgery. So they will not ask about you about carotid tumor at this level. The most important thing is the cardiac murmurs. This is a very important topic because at a foundation year level or the house job level, you listen to the chest and you diagnose patients. You listen to the murmurs. Even if in your final year MBBS exam, the examiner wants you to understand what kind of murmurs are there. So in MRCS exam, you have to know what type of murmur is this, and for through which wall it is related to. So, and what is the location of this type of murmur, and sound of the specific valve which will you hear at that level. So if it's a fourth vertebral level, you have to know what type, what is the sound you are hearing, and if it's a second intervertebral level, is the second intercostal level, you have to know what is the valve location and what is the murmur type. Next are the aortic dissections. You have to know what are the symptoms with which patient present with aortic dissection. Then there are certain investigations you will do regarding the aortic dissection. The condition patient may present with aortic dissection, and you have to know what kind of investigation you will suggest to the patient. There will be a simple chest X-ray will show a mediastinal widening, so you can suggest the patient about that and what is the management, like aortic valve replacement and everything. So you have to know these things, and this is an important topic regarding vascular diseases. And then the acute limb ischemia, the 6 points of acute limb ischemia, you have to know that. What are the 6 P's? The pulselessness, the pallor, the paresthesia, and peritoneal cold. These points later we will discuss when we will discuss about this topic in further. Then there are lower leg then there are lower leg ulcers. Lower leg ulcers suggest what are the stages of the leg ulcers and what are their differentials. There might be arterial ulcer, there might be venous ulcer, or might be a diabetic ulcer. So you have to know what is the difference between them. Examiner might want you to know what kind of ulcers are there, and you can diagnose them easily. Then comes the genitourinary disease. The genitourinary disease, some examples include in pediatric disorders like foreskin hypospadias, epispadias. That's a hot favorite question of the examiner, and often one two questions are asked about in the genitourinary section, where one question is limited to the foreskin disorder. Like in hypospadias, you see a patient with hypospadias and its location of the hypospadias. When will you do the surgery, and when will you not do the surgery of the foreskin removal? Then there is disorder of the penile fracture and penile erection disorder, like physiology, how the penile erection occurs, and the management of penile fractures. I have specifically labeled it because that's an important question. Next comes the prostate cancer. Prostate cancer screening is very, very, very important. You have to know how do you screen the patient of prostate cancer who is at high risk and who is at low risk. So you have to know what type of screening program are employed in UK, and what is the standard screening program in UK. Then there are renal stones. What type of renal stones are there, and what type of imaging you will do, and how and what is the type of management for different sizes of stones. So it's less than 10 mm, 10 to 20, 15 mm, 15 to 20 mm. So different stones have different management. Then comes the renal, bladder, testicular carcinoma. I have labeled it separately because the staging is important, and the biopsy is important. If you're testicular carcinoma, you are suspecting it, you have to know where will you take where you enter to take the biopsy. You cannot just pass through the scrotum. So that's a technical point, and we will discuss it when we'll discuss about the genitourinary disease. Next is the disease of head and neck. In head and neck, the examiner may ask you about head injury. The favorite questions are the extradural hematoma, the subdural hematoma, the subarachnoid hematoma, and a skull fracture with or without third nerve palsy. So that's a very important point. You have to look for the third nerve palsy. If there is a blown out pupil or there is a dilated pupil, it will suggest that the brain has herniated already in head injury case. Next is the facial nerve palsy. It can be an upper motor neuron line palsy, the lower motor palsy. You have to know the difference between these two and what are the symptoms of them, and causes. They might ask some causes, or simply they will ask just this is a lesion. Suggest what is whether it's upper motor or lower motor. The question might be like that. Next is the parotid or submandibular gland. These two glands are very important, and between them. They will ask mostly about the surgical complication while doing these surgeries. So if we are doing a parotid surgery, which type of nerve is damaged? If you are doing a submandibular gland surgery, what might be the complications? If you are removing the duct, which nerve can be damaged? If you are removing the type of nerve can be damaged. So nerve damage is different in the case of gland, and nerve damage different in case of removing the submandibular duct. and some what is the what superficial structure can be damaged, different structures, and when we will discuss about the head and neck, we will discuss it in detail. So certain neck lumps, you have to know what are the differentials of neck lumps. Then the epistaxis. For epistaxis, you just have to know the anatomy. Okay. Regarding orthopedic conditions, we discussed in our last webinar what are the different orthopedic conditions are asked in the exam, and like this, lectures, I just summarized it. Common condition include fractures in trauma like hip, knee, and ankle fractures. Most commonly examiners' favorite topics are ankle fractures. They ask about syndesmotic injuries. They are very much liking the syndesmotic injuries, and they will ask about what is the patient has Weber C fracture, what is the management, Weber 2B fracture, what is the management, Weber 1, Weber A fracture, what is the management. So different fractures have different managements. Okay, then the upper limb fractures. What are the complications might be there? Then there are stress fractures, and in children they might want to ask you about the physical injuries. What are the grades of what are the classification of physical injuries? Salter classification is examiner's favorite classification, and they will ask about the Salter classification, type 1, B, 2, 3, 4, 5, different classification. Next are the osteoporosis. They will ask about the screening protocol of the osteoporosis, like we discussed in our last section. What is the screening program for osteoporosis? When will do the screening program? What is the prophylaxis? And what is the management of osteoporosis? So we can manage conservatively. We can get the DEXA scan and all that. Then there are the endocrine disorders. Examples include endocrine disorder like thyroid gland. Like this is the examiner's most favorite gland. And it will ask about what the cyst of the thyroid gland, what is the tumor of the thyroid gland, inflammation, the thyroid function tests are there. You have to know these things, and thyroid gland you have to know from A to Z. Thyroid gland you cannot leave it as such. So everything about thyroid gland is important. Even the parathyroid gland, because of its close proximity to the thyroid gland, it becomes important. Then probably related to parathyroid, the calcium metabolism becomes important. So you have to know the whole chain of the calcium metabolism, like starting with hypocalcemia, hypercalcemia, and primary parathyroidism, secondary hyperparathyroidism, tertiary hyperparathyroidism. So this all becomes important, and the thyroid gland and the parathyroid glands is examiner's most favorite. And I'm telling you again and again, and you cannot leave it. Then a pancreatic secretion. Regarding pancreatic gland, they will ask about secretions, what type of secretions are there for regarding endocrine secretions and the exocrine secretions, and then regarding endocrine secretions and becomes insulin and insulin. They will ask about in diabetic sections, how it controls the metabolism, like glucogenesis and gluconeogenesis. They might touch that subject, especially in pathology and physiology. Then the regional masses like pheochromocytoma, they will ask about the different aspects of the pheochromocytoma, how will you diagnose it, what are the investigation you will do, and what is the management, and how will you proceed with its management, and continuous screening program and like that. So in skin disorders, that's rather not in a very important section, but still some MCQs come from this section. About two MCQs, 2 to 3 MCQs they make from this section, like benign skin lesions, like what are the types of benign skin lesion, like sebaceous cysts are there. So most importantly, they ask about the sebaceous cyst and punctum is there or not, the dermoid cyst, epidermoid cyst, like that. And some malignant melanoma is I mean, as a hot topic from the skin disorders. They will commonly ask for malignant melanoma and how much skin that you will excise, if the tumor size is this and that, and this is examiner's favorite question. And I also remember that I had about 2 MCQs directly related to the malignant melanoma. So in skin section, malignant melanoma is very important. Then I specifically mentioned that the rejection margins, how much rejection margins are should be there. So that classification we'll discuss when we'll discuss that topic in detail. Then comes the acute emergencies, because this is a vast subject. This is a vast topic because this section often combined with critical care and most conditions related to urgent decision making in emergency. You will have, if you are a clinician, will have definitely faced the emergency room Nalima, where you have to make the urgent decisions in after examining the patient, and you have to know when to do the urgent needful work. certain examples of the emergency cases you will face in your exam. Also, the common examples include the anaphylactic shock. What type of antidote will you give in a particular poisoning case? So if a patient comes just with a sting bite or bee bite, there is a scorpio bite or a snake bite. What type of antidote will you give? If your patient is suffering from some other disorder, patient certainly goes into shock. You have to give the you have to do the needful, and you have to give the uh, antidote. What will you give to the patient? You have to know certain antidotes to the different drugs and different poisons. So anaphylactic shock, how will you manage the anaphylactic shock from A to Z? You have to know this you cannot just leave this section. And then there's the management of the myocardial infarction, the thrombolysis or the percutaneous intervention. This is another very important topic, because it they will ask you in different shapes and in different varieties. They will ask you about MI, myocardial infarction or acute coronary syndrome. They will ask you definitely. No examiner will not be satisfied without asking you this question from this section, acute coronary syndrome. And in emergency section, you will face about 5 to 6 questions directly. Or in other sections, like they will ask you some question from the trauma section that will be related to the acute emergency also. But directly, some questions will be related to the acute coronary syndrome. Then they will ask questions some related to hyperkalemia or hypokalemia. Some question will be related to the hypothermia or hyperthermia. And then the compartment syndrome. Compartment syndrome, you have to know how to diagnose it and what is the management related to the hypothermia, because UK is a cold country, and patient often comes with this type of hypothermia, and they will ask you about one question related to hypothermia. But again, I'm stressing on the acute myocardial infarction because they will ask about you about the myocardial infarction and acute coronary syndrome. They will definitely ask you, and you have to know every aspect of this section. So that's all. I have summarized these questions, and I just have made this slides to just give you an outlook of how these questions might be asked in your exam. This does not complete our syllabus, but this is a section, a small chunk from your exam. And there approximately this section makes approximately 45%, 45 MCQs, or about 30% of your exam. But its importance lies with the fact that it covers all the systems, and certain important conditions are examiner's favorite. So if you go to the most favorite things, like certain favorite topics, you go through them, and you go through them fully. You know the every itchy bitchy of these topics, you will definitely score higher. And in the past trend, the exams trend is changing now. They are making difficult exams because the competition is getting higher day by day. They are making difficult papers, and they go into details of every topic. It's not like simple. You will see that the simple question, the single line question, like, oh, you are doing the hernia surgery, and there's a nerve there, and it's being compressed, name the nerve. Like, this is not like that. They will definitely circle you around. Like, they will ask you question like, oh, there was a policeman, and he was using tight belts, and now he is having paralysis. He cannot he's now comes to your clinic, and complains that he's now feels numbness, or he does not, he feels funny sensation in the lateral side of the thigh. What type of what might he be having? So you will now again, the answers will be simple. Like, they are asking about the lateral cutaneous nerve of thigh. A simple answer is the lateral cutaneous nerve of thigh, but they have now rotated the whole question, and made a scenario out of it. So the statements will be quite long, but the answer is quite simple. So if you are familiar with the whole of the anatomy, and you know the basics of these topics, and you regarding these common conditions, you know everything, then they cannot fail you. So the effective study strategy include active recall, repetition, and group study. Focus on understanding rather than memorizing. So utilizing resources like these apps and quizzes can enhance your learning. Again, the conclusion of our today's discussion is that the principal surgery section in the MRCS Part A exam has foundational knowledge of surgical sciences, including anatomy, physio, patho, and general surgical principles. Sixth section emphasizes critical thinking and application of clinical knowledge to solve surgical quizzes. A solid grasp of the subject is essential for safe and effective surgical practice. So I would again suggest you that you first you go through the simple things and the common conditions. Then you can focus on the difficult topics also. But often a student becomes confused in the difficult topics and leaves the most common one also. So this is the mistake you should not do. If you are preparing and you want to prepare well, you have to go through the simpler topics in full detail. If a topic is simple, it doesn't mean that it's not important. If a topic is important and it's repeating in different past papers, it means that topic is very, very important and you have to know further details of these topics. Even if you have to study it more, just study. But that topic cannot be left as such. Uh, some difficult topics are there, but the examiner will ask you, will not go into the deep depth of that difficult topics. The simpler topics, there are certain pool of these topics in your exam, and the examiner will continue asking questions from these topics. So try to focus on these topics. So key takeaways: the surgical anatomy, the physio and the patho, the wound healing and infection, the pre and post operative care, the trauma management, the surgical techniques, critical care, ethics, and legal issues. These quite summarizes the sections of the MRCS Part A, and these sections will be discussed later when we will discuss each section for and take a separate class for each section. So if you have any questions, you can ask me now. Session is ended. If there are any questions regarding the exam, regarding your confusions of the exam, if you have any question, you can ask me. If you are new to the subject and want to know anything further about MRCS, you can ask me. You can even message us in our group. Okay, so yes, sir. Course details will be shared to you by our admin, and she will send you the details of our courses. Uh, approximately 4 months, I would suggest at least 4 months you spare for the exam, because now the exam is becoming difficult with every passing day, and you have to again rehearse, revise, and discuss. First, you go through the whole syllabus. Just read or listen to the course and listen and prepare. You hear the presentation, listen to the presentation, make your own notes, prepare them, rehearse them, and discuss them. Finally, we will give you certain tests to evaluate you. You can get evaluation easily, and then you can confidently assess that whether you are confident enough to sit in the exam or not. Hopefully, if you stick to the plan, you make your plan from day one. You stick to that plan. You start with the anatomy section, or you can start with physio. I would suggest that you start the basic sections, then day by day, you as you know things, you can start with the complex things. You can focus on one or two systems, like you start with the gastrointestinal system and then start with other systems. but cover disease with every system, and this will be no issue for you. So any other question? Welcome, welcome. Rizwan, welcome. Okay. Resources will be shared in our WhatsApp group. All resources will be shared in our group. Not to worry about that. There are easy resources. Resources are simple. If you are new to the group and want to start, I would suggest that start with the basics. Start with the basics. Um, um, Go through your old books first. Our course is, of course, maximum of 3 or 4 months duration, and but this will be a rigorous course, and you have to focus on focus full time. If you are doing a job, uh, you have to spare about 5 hours, 5 to 6 hours daily. Dedicated time for study is required for this exam, because you pay quite heavy fees for this exam. uh, Aban, EMRCS subscription would be enough, or we need to go through the textbooks also? No, you have to go through the textbooks also. That's a fair question, fair answer. Uh, you cannot rely just on the MRCS subscription. That's one way to test you. Our syllabus is basically designed like that. It will, yes, our syllabus is designed to give you the MCQ. We will test you with MCQs. We'll test you with the recalls. But first, we will go through the whole syllabus, so that you can know what type of syllabus are you dealing with, what type of questions are you dealing with. First, you have to know the whole of the basics. Without basics, you cannot make a firm start. Welcome, welcome.
ഞാൻ ശനിയാഴ്ച വരാം. ശനിയാഴ്ച അല്ലെങ്കിൽ ശനിയാഴ്ച വരാം. അല്ല ഞായറാഴ്ച വരാം. ഏതില്ല നിന്നെ വിളിക്കാം.
If you want to ask question, just write it in the message section. I will see. Again, the take home message is this is a commitment to yourself, because this exam has huge fees. Both part A and part B has about 1,100 pounds fees. Part one has about 650 pounds. Recently, I saw that there's a 650 pound fees. So it's quite a huge commitment to yourself, and you have to know you have to get some help from your colleague, or from a course that will help you in easing your journey, because 4 months is quite a large commitment if you are preparing for the exam, and you cannot prepare it alone. Our course is designed in such a way that first we will get a full recall of the whole syllabus. We have divided the session in different modules, and you will hear our lectures. Will give weekly lectures, and later we will just give you the test and evaluate you. And personally, if someone needs help, we'll definitely help. him or her. Okay, thank you everyone. If you have any question, you can ask in our WhatsApp group. We'll definitely answer these questions, try to answer all your questions. Thank you.